Welcome to the Fit for Work webinar, Making a Referral for GPs. Fit for Work is a new voluntary service that offers the wider working population access to occupational health support. The service helps workers with health concerns to both stay in or return to work should they be off sick for up to 4 weeks or more. Using a biopsychosocial approach, this assessment will identify all obstacles preventing the patient from returning to work. Advice regarding appropriate interventions will be given and a return to work plan will be produced, exploring health, work, and personal factors which might prevent the person from returning to work. Signposting to other services for support with health-related issues, workplace issues or adjustments, and non-health or non-work related issues if appropriate. There are 2 elements to Fit for Work. Advice. Access to health and work advice for patients, GPs and their employers through a website and free phone helpline. Assessment. Working patients can be referred by their GP for a 45-minute telephone assessment with an appropriately qualified healthcare professional. Recent studies show that being out of work for long periods of time is damaging to health, social and financial well-being, and the longer someone is off sick, the harder it is for them to get back to work. Returning to work is an important contributor to patient health, and Fit for Work will help support effective clinical management of a GP's patients. Here are some common questions asked by GPs. Who is eligible? Fit for Work is a service for people who are in employment, not the unemployed. Patients are eligible if they have been, or in the opinion of a GP likely to be, off work for 4 weeks due to sickness and have a realistic outlook of returning to work. Will Fit for Work lead to an increase in my workload? No. The service is designed to decrease a GP's workload as it will cease the need for a patient to return to their GP for fit notes. Does my patient have to consent? Yes, the service is voluntary. Patients must give verbal consent to be referred and share their return to work plan. Will Fit for Work health professionals have access to my GP notes? No. The health professional will only have access to the information you supply on the referral form. What's the outcome of the assessment? Once a health professional has conducted the assessment within 2 days, a return to work plan will be created. The patient's employer can accept the return to work plan as evidence of sickness absence in lieu of a fit note, so the patient will not need to return to their GP for a fit note as well. What are the advantages of Fit for Work? For patients, an earlier, more manageable and sustained return to work covering health, work and personal factors, as well as reduced risk of job loss and welfare dependency. For GPs, accessible expert support around clinical management of sickness absence, saving time spent on repeated sickness absence visits. How to make referrals. To be eligible for Fit for Work, patients must live in England or Wales, be employed, and have been or be likely to be off work for 4 weeks or more. GPs need to visit the referral page on the Fit for Work website. Complete the details about your practice and save them here, so you don't have to enter them again. Enter the patient's details. Tick the declaration box to confirm the accuracy of the data you have entered. Enter the captcha code to confirm that you are a real person. and click Submit.